Thank you for joining us today. My name is Janik Goriev, and I'm the Health Information Specialist with Brain Tumour Foundation of Canada. We are very excited to be offering our 8th webinar of the 2013 Healthcare Professional Webinar Series today. Today you're going to be hearing from 4 survivors, and we are so pleased that they could help us today and join us and share their stories. Before we do get started, I have 2 poll questions for everybody who is online, and I'm just going to launch the first poll question here for you. Give me one moment. Sorry, just some technical difficulties here. So if you can choose the type of person you are joining us today on the webinar, whether you're a healthcare professional, a family member or a friend, a patient or survivor, a volunteer or other. Great. So it looks like about 71% of you are healthcare professionals. And so for those of you who are healthcare professionals, if you could let us know if you're a physician, a nurse, a social worker, an occupational therapist, a PT or a speech language pathologist or other. Great. So we have a little bit of a mix here. Some nurses and some social workers. Wonderful. Thank you. And so we're going to get started with our first speaker today, Karen Metcalf. Karen is actually joining us from Windsor, Ontario, and her daughter McKenna was diagnosed at the age of 4 with a pilocytic astrocytoma in 2010. And I'm going to turn it over to Karen. Thanks, Karen.
Hi, good afternoon, everyone. I was very excited when Janik asked me to participate in this webinar, and I just wanted to thank you all for taking the time to hear our stories today. Now, I have to see how I advance the next slide here. There we go. This is our family, and it was about 1.5 years after McKenna was diagnosed that we took this picture. That's my husband, Brett, and little brother, Blake, who's now 6, and McKenna, who is now 8, and myself. There were symptoms that, as my husband and I looked back, we could now say were present months before the diagnosis. So if you'd asked me back when she did get diagnosed if these symptoms were there, I probably wouldn't have noticed them, but now that we look back, we can see them. Whenever McKenna would go to have a bath, she would put her head back a certain distance, and then she wouldn't be able to put it back anymore. And she'd say, oh, that's as far as I can go. And we just thought it was a stubborn 4-year-old telling us that she wasn't going to put her head back anymore, rather than the fact that she physically couldn't do it. She also had headaches, but at 4, she never told us that she had a headache. What she would say to us was Tupi and Banu, who are the characters there on your screen, were jumping on her head. So she and I would be having a conversation, and she would look like she wasn't paying any attention, and she would say, Tupi and Banu are jumping on my head. And it wasn't until later that we realized that she was having headaches. She also would have irritable behavior, which was not typical. McKenna was a very even-tempered child when she was 4. She didn't have extreme excitement at times, and she also didn't have any behavioral problems at all. I can't recall a one. So it was a few weeks before any major symptoms started. She had a complete meltdown about a shirt she picked out to wear to school, and it was so surprising to me that I kept her home from school thinking she was coming down with something. Then a month before she was diagnosed, we had some of the typical symptoms that people seem to talk about when they talk about brain tumors. She was complaining of neck pain, and this was confusing for us because at the day before she started complaining of neck pain, she had fallen very hard on the ice while she was ice skating. And so all these complaints we were attributing to this fall on the ice rather than a brain tumor. At Christmas Eve, that was when she fell on the ice, and we associated everything with the fall. Then a couple of days later, she had a major flu-like episode. We were in Toronto. She was very lethargic, and she was most comfortable laying down. But the throwing up was almost all day. It was a very bad flu. So I brought her back to Windsor, and the symptoms subsided, and it would happen every couple of days. So when she really started to show the symptoms, the diagnosis took about 1 month. We had 3 appointments at the GP. We were getting told that it was a flu, that the neck pain was probably associated with when adults get shivers and pains and their body hurts. The neck pain was probably the same thing. We then went to the ER because I noticed that she'd been throwing up for 3 weeks, and I'd been cleaning it up for 3 weeks, and no one in the house was getting this horrible flu that she had. And I also noticed that she was hungry after she was sick. So she'd throw up in the morning, she'd cry in the night about neck pain, and then she would be hungry afterwards. So we went to the ER, and they did an x-ray, still thinking that this had something to do with some sort of whiplash type thing from a fall, and there was nothing. So an appointment was made for an MRI to happen 10 days later. She went for the MRI, and within 5 hours after the MRI, we were called by the pediatric oncologist on call at Windsor Regional Hospital, and we were told that McKenna had a large tumor in her cerebellum, that we needed to get to the hospital as soon as possible, and that an ambulance would be waiting to take us to London. So we were eventually told that it was a cerebellar pilocytic astrocytoma, and it was a grade 1. When we got to London, the first surgery happened within 48 hours of arrival, and it was 15 hours long. After a post-op MRI, the doctor wanted to go back in because she believed there was residual tumor, and that the best prognosis for McKenna would be if they totally removed any tumor that they saw. So 36 hours after her first surgery, McKenna had her second surgery. She was in critical care for 10 days, and we stayed in London for a month. So the reaction from family members and friends, obviously even with ourselves, the initial reaction was shock. And overwhelmingly, what we got was major support in various ways, even from perfect strangers. So Brett and I my husband and I have a very supportive network of friends and a very large network as well, and they all came through. My family did anything that we needed. And our biggest concern probably was for Blake, who, when we were told we had to go to London, he was 2.5. And I basically said to him we were leaving. My parents came over, and we didn't see him for 10 more days after that. So people just stepped up where they needed to. The gifts were overwhelming. And just to give you an example, when we went to Build-A-Bear with a gift card that McKenna had received in the hospital a month after she came home, the people at the store knew us when we went in. So McKenna has a huge collection of Build-A-Bears because everybody just thought this was something that she needed. The school had a fundraiser. Strangers were sending us gift cards for gas and food in the mail, and it was unbelievable, the support that we got. There were people who didn't know what to say, and sometimes their doing nothing or saying nothing was actually probably the worst reaction they could have. So my brother-in-law is a good example. He didn't know what to say, and so he called me and said, I don't know what to say. And I thought that was a really great thing that he did, because the people that stayed silent, it was more difficult to deal with them later. We did have people who were telling us the day we found out her brain tumor was benign. She was still in critical care. They told us they thought it was benign. We didn't get results for a week or so after that. But people would look at us and say that we were lucky. And although my husband and I felt extremely fortunate, we didn't think that others should be pointing this out to us. We thought it was our place to feel it, but not their place to say it. So some tips for healthcare professionals. I have tips from myself and my husband, and then I have tips. The next slide will be tips from McKenna. So from a parent's perspective, the resources and expertise that we were provided to us were very important. The Brain Tumour Foundation handbook was terrific. I will admit that until McKenna came home, I never looked at the handbook, but my husband used the handbook from the second we got it within hours after we arrived. He read it from back to front. He referred to it constantly. He used the facts to tell people and communicate to our friends about what was going on. And it also helped us to ask questions of our doctor that were more informed and refer back when the doctor said something we weren't sure about. Our doctor in London, she gave us a copy of the handbook, and she used the back resources pages in it to write out the possibilities of what McKenna's diagnosis was and what it would mean. There was also a back-to-school program in London that they set up when we were in London. McKenna, when she was in JK at the time, and she had a little girl in her class who the very same weekend that McKenna was ambulanced to London, this little girl, Katie, was ambulanced as well with leukemia. So we had two little girls from the same class, from the same school, ambulanced on the same weekend. So these kids had a lot of trouble understanding, and so did the teacher. And so they had a nurse go to the school when McKenna and Katie were ready to come back to school, and they came back at the same time. And the hospital organized this, and it eased my concerns about the questions the kids would have, and it also helped the teacher in a lot of ways to respond to questions that she didn't know how to answer. The experiences of the critical care nurses, actually of all the staff, I remember specifically when we first got to the hospital, the first thing one of the nurses said to me was, "Don't Google this." So that was the best advice I could have had, because when I look back now, a lot of the things that would have come up when I Googled were things that I never even had to think about. And so it would have set me off on a path that probably was not a very good one. The other thing they told me was to go to sleep when she was in critical care, because there was going to come a point when McKenna was going to need me and I wouldn't have those nurses and healthcare professionals available. And so it took the guilt away because they were telling me to do it. And so I felt that I should do that. And one of the social workers said to me, I was feeling very overwhelmed and guilty about all the gifts and support people were giving us. And she pointed out to me that people were doing this to make themselves feel better, and that it was good for them to do it. So that was a piece of advice that was very useful to us. The other thing that the team did was focus on the whole family. Blake was always included. Once he came to stay with us at Ronald McDonald House, he was included in the playroom. He was included in when they were drawing blood. They would include him and get a treat out of the treasure chest. They were great with him. And there was a social worker who would just sort of drop by the room, and if she hadn't, I would have told you that I didn't need to talk to a social worker. And it ended up that she and I would sit and talk for hours at a time. So that was something that was very important to us as well. And the third piece of advice is be accessible, especially after going home. We have been extremely fortunate in that our team, I can send an email, I can call, and I get an immediate response. And after coming home, there were some things that came up. McKenna had some visual issues at first. When I contacted the team about that, within a day she got an MRI. She had to have a cranial rivet removed, and they set up surgery, and they took care of that. About a year ago, she started to have trouble at school, and they got a neuropsych assessment within 4 months, and she's been able to get some supports in place in school. And just recently, she had a diagnosis of scoliosis, and the team there decided to treat it as part of McKenna's ongoing experience from having her brain tumor, and so they're sort of connecting the dots for us, which has been very helpful as well. So we don't abuse this contact, but it's very comforting just to know that if something seems critical to us, we can get the help that we need. Now, these are the tips from McKenna. So I told her I was doing this today, and she offered some advice. So her advice is that sometimes when she goes for MRIs, she gets a warm blanket, and sometimes she doesn't. So she says that every time you should give a warm blanket to make MRIs cozy. And in terms of your food and menu choices, you must serve bacon. McKenna had never had bacon before she went into the hospital, and because she had low sodium levels, bacon was on the menu. So she now has an obsession with bacon. And the last thing was when she first had her MRI, she had an earplug put in her ear, and she had some stickers, I'm not sure what they're called, but to do the, she had some stickers put on her head to map her brain. And she found a sticker about 2 weeks later that was still in her hair, and she found an earplug when they went to go take the bandages off her head to come out of critical care. So she said, don't forget to take these things off. And these are just a few pictures of our family enjoying the Brainwave program. It took us about a year before we went to a Brainwave event. We started 3 months after we got home with going to the Spring Sprint, which we now do every year. And I have to tell you that now with the Brainwave program, it's something that we look forward to and make sure that we don't miss. Thank you so much, Karen, for
for giving us your story about you and McKenna, and especially thank you to McKenna for providing some tips and suggestions to you, the healthcare professionals. Very cute, very sweet. We've got our next presenter coming up here in a moment, Jen Brew, and so we're just going to get her presentation up here for you. And Jen Brew is actually located here in London, Ontario. Jen was diagnosed with an ependymoma at the age of 19 in 2005. And so I'm going to turn it over to Jen in just one moment here. Here we go. So I apologize, this reference to kindergarten cough is just never going to get old for me. All right. Technical difficulties. Oh, here we go. There we go. Okay, thanks. So it was the spring of 2005 when I first began experiencing symptoms. I started noticing these strange sensations at the back of my head if I got up too quickly or moved in a funny way. I was finishing up my exams of my first year of my undergrad at Western, so it was pretty easy for me to just brush it off as stress-related or something like that. So I mostly just ignored them, even as they grew worse throughout the summer. But by the end of the summer, the headaches were getting worse and more frequent. I still wasn't too concerned at this point, though. But by the end of the summer, it was ragweed season, and my allergies were driving me nuts. So I decided to make a doctor's appointment to talk to my doctor about my allergies and figured I would mention the headaches while I was there. So I saw my doctor and I told her what was going on, and surprise, surprise, she wasn't all that interested in my allergies. She ordered a CT scan instead, and there was a bit of a wait before the scan, and my symptoms really started to worsen in that time. Every morning I woke up with a pulsing headache, and usually I'd get one later in the day too. And my appetite was starting to be affected, especially in the morning. So I basically stopped eating breakfast and reduced what I ate at other meals. So I started to lose weight, which kind of have a small frame, so that was a little bit alarming. So it was a gray and ominous day in November of 2005 that I had the CAT scan, and they spotted the tumor right away. At this point, at least for myself, I knew something was wrong, so the diagnosis wasn't a big shock to me. It was a bit of a relief, actually, but my parents had been holding out hope that it was, stress or hormone-related or something less terrifying than a brain tumor. So they had a bit of a hard time with it, which brings me to my first tip. Don't have the worst case scenario conversation 30 minutes after being diagnosed with little to no information on what the actual prognosis might be. So what happened was I had the scan at Victoria Hospital here in London, and they told us there was a lesion on my brain. So then we were sent over to University Hospital where a doctor would be waiting for us. And so I don't really know the reasoning of what happened, but I was told to go change into a gown. I was in one of those little pods at the emergency room. And while I was doing that, my parents were ushered away by a social worker. And so I was waiting around and finally stuck my head out and saw them talking to her, and they looked just absolutely devastated. So they eventually came back, and eventually I found out the story. I guess the social worker had told them that this was very serious, and they should prepare themselves, whatever that means. I don't know if, I guess my parents looked upset, but I don't think any more upset than what would be expected of parents who had just learned this about their daughter. And we never saw that social worker again. So I think she had been referred to try and comfort my parents, maybe, but it kind of had the opposite effect. And I didn't really appreciate, I was 19 at the time, and I didn't really appreciate being excluded from the conversation. So anyways, another tip, visual aids are great. So I had an MRI, and surgery happened quickly. My surgeon was Dr. Megacy, and he was really great. He explained everything really clearly. and he used the Brain Tumor Foundation handbook to kind of map everything out and drew exactly where my tumor was and that sort of thing. So having that visual helped me, and then it was a record, too, of things we had talked about. So I had surgery. It was about 10 hours long, but it went really well. My parents and family had been hanging out in the waiting room all day, and so when they finally got the good news, from what I hear, the waiting room looks something like this. So I spent about a week in the hospital recovering. I saw a physical therapist as well as an occupational therapist briefly. I had a bit more recovery to do once I was home, mostly with my balance and dizziness, stiffness in my neck muscles from the surgery, and just some fine motor skills in my right hand. About a month after surgery, I began radiation treatment. And I had the most misconceptions, I guess, about radiation. I didn't know very much about it at the time, so I had all these kind of strange fears about what might happen. Some of my knowledge of radiation comes from comic books and that sort of thing, so I was afraid, well, I wasn't really, but didn't think I'd turn into Dr. Manhattan or anything like that. And not to be another person hating on Lance Armstrong, but it's kind of Lance Armstrong's fault, because I had read the It's Not About the Bike book, I think it was called, and I'm probably even not remembering it accurately, but I remember him talking about when radiation was discussed as possible treatment for himself, that he didn't want to do it because he had heard people weren't the same afterwards, after radiation to the brain, and could affect your personality and memory and all this sort of thing. But anyways, I had radiation and it didn't have any of these kind of side effects. I really only felt tired and some hair fell out, but that was about it. And anyways, so I had 6 weeks of that, and it was fine. And now I just have MRIs to keep an eye on things. Now just down to once a year. It's been about 8 years now, and they wanted to monitor for 10 years, so it might only be 2 more years to go. So anyways, things are good. This is me with one of our cats. I'm working as an occupational therapist now, so that's great, in the community here in London. And I just got married in August, and life is pretty great at the moment. Thank you so much to Jen Brew for providing us her personal story. I also want to mention that Jen Brew also volunteers with us here at Brain Tumour Foundation of Canada, and I also want to mention that Karen Metcalf also, Karen Metcalf as well as Jen Brew also helped us create the non-malignant handbook that we actually launched a couple of years ago. And so if you're interested in getting any of those resources, you can just contact us to send out an information package to you. And the next person up to the mic is Jen Hazel. And Jen Hazel has come in from KW area, right? The Kitchener-Waterloo area here in Ontario. And Jen was diagnosed with a meningiooma at the age of 39 in 2011.
Hi, everyone. My name is Jen. I'm really happy to be here to speak to you all. So this picture was taken, as it says, in 2010, Christmas Day. That's before my life would change. I had absolutely no idea what would be coming in the next few months. The only symptom I had before my diagnosis was a headache. This was in May of 2011, and at the time there had been a lot of rain. It was raining almost every single day. I knew a few people that had headaches caused by the barometric pressure, and I figured that that must be what my headache is all about. On my commute to work one morning, it felt a little worse, and I decided to go and get it checked out. I had an aunt that had passed away from an aneurysm, and I thought, you know, this is just silly. Go and get it checked out. If it's the weather, then, you know, I'll just get sent home. So I took myself to the ER, totally expecting that I would be going back to work shortly after. That was not the case. Upon telling the ER doctor about my symptom, which is the headache that had been hanging on for a few weeks, he suggested that I get a CT done because I had no history of headaches before. I've never had migraines or anything else. He thought it would be best to do a CT scan. The CT scan was done, and you know, the rest is history. It showed the mass in my brain. It showed the tumor. He then ordered an MRI so that they could get some more details on it. Yeah, that was difficult. One of the first things I did when I was given the diagnosis was I wanted to see the tumor. So thankfully they allowed me to do that. I guess it kind of validated what they said. So from the time I was experiencing the headaches to the time I was diagnosed was probably about 2 to 3 weeks. It took 2 months after my diagnosis before I could get to see a neurosurgeon. Unfortunately, the neurosurgeon I was sent to was not able to do my surgery, he told me, because of the complicated location of it. 4 months later, I got to see a neurosurgeon that was able to do my surgery. It was originally going to be in 2 parts. I underwent the first 15-hour craniotomy. I also had a craniectomy, so there is part of my skull missing right now because they left it out just in case there would be any swelling. One of the complications of my surgery was that my optic nerve got severed in the process, and I'm now permanently blind in my right eye and also have third nerve palsy, which has left my eyelid closed. An unexpected complication, but when you're dealing with the brain, you know, anything can happen. I decided not to have the second part of my surgery. A difficult decision, but at the same time, I came out of my first half alive. So instead of having the second part of my surgery, I had radiation treatment the following year, which was last year. And right now I go every 6 months to be monitored to make sure that my tumor is not growing. Here's a few pictures of my time in the hospital. The first one being when I woke up in the ICU. My face was completely swollen. I kind of looked like I went a few rounds with Mike Tyson. The next picture just shows some of the staples. Well, 50 of them it took to close my incision. Here's a picture of me during my radiation therapy. That was quite an experience. First of all, having that mask fitted was, I mean, if you're claustrophobic, it is quite the experience. They slap this warm, wet stuff on your face and mold it. It has to be a perfect fit because when you're getting the therapy, they want to make sure that the beams are hitting exactly where they're supposed to be hitting. So you get the mask on and then your head is basically secured to a table so you can't move. But it had to be done, so I did it. Within regards to the reaction from my family and friends, my family was understandably shocked. It's funny because when I was in the hospital getting my diagnosis, my mom knew I was in the hospital for my headaches. I had already had my diagnosis when I spoke to her on the phone, and she asked me if I had seen a doctor yet, and I actually told her that I hadn't because I didn't want to give her the news over the phone. Within regards to my friends, I don't have many anymore. A lot of them have just disappeared. They couldn't deal with it. They can't deal with it. I had a best friend that I had my entire life, and she's gone. So that was difficult to be going through something like this and not have the people that have been in your life for so long. Yeah, to not have them help you along this journey. So my tips for healthcare professionals, for me, the Brain Tumour Foundation of Canada Handbook was an amazing resource. When I was in the hospital, I was very lucky to have someone give me this book. I've learned that since my surgery, not everybody gets this book, not everybody has the opportunity to read this book. So as a healthcare professional, if you have access to these books, it would be awesome if you could pass them along to your patients. There's so much information in there that they could benefit from. I remember when I found out about my tumor in the hospital, the first thing I did was get on my cell phone and start looking things up. I didn't know what I was reading. You don't know who's posting things, but with the Brain Tumour Foundation of Canada's handbook, I mean, that is very solid information. Ensure your patient has a positive support system around them. Family is very important. Also, having access to a multidisciplinary team can be very helpful. There are so many people, social workers and therapists and whatnot, that I have had to, I guess, deal with, and that have had to deal with me. And it's so beneficial to the patient to be able to talk to these people and to have people that can understand somewhat what they are going through. Mind you, I have come across a few people, social workers and whatnot, that I don't think, to be honest, quite understood me and the journey of a brain tumor patient. And what I've done with that is actually given them the Brain Tumour Foundation of Canada handbook in hopes that that can enlighten them. It's amazing to me in my travels, whether it be to a hospital or, you know, at the grocery store, standing in line and, you know, just starting up conversations with people. It's absolutely amazing to me how many people know someone or know someone that has a brain tumor or that has been affected by a brain tumor. I don't even think I realized just how prevalent brain tumors are until I myself was diagnosed. I'm hoping that by all of these awareness events and just by spreading the word and giving out the handbooks, that it will truly shine a light on the brain tumor survivors, the patients, the families. It's incredibly important. I guess that's about it. Thank you for your time.
Thanks so much, Jen. That was great. Really appreciate everybody coming in actually and you know, giving their personal stories, their stories of courage and hope, and you know, giving us feedback as to, you know, what their experience has been through their brain tumor journey. Okay, so next we have Rick Robbins. And Rick is a local gentleman from here, London, Ontario again, and Rick was diagnosed with a glioblastoma multiforme at the age of 56 in 2009. and he's going to give you a little bit of his story.
Okay. Hello, everyone. Thank you very much for the opportunity to share my life with cancer. I hope at the end of this you will have a perspective on how life has been for me since being diagnosed and operated on. Background, I'm 60 now. I was 56 when I was diagnosed. I was born in Chatham, live in London. This is I've taken my cancer to Florida with me, and that's a picture of it, of us. This is my son, Chad. He has been instrumental in my life, especially since the cancer. My daughter, she's 18 and going to school, has provided inspiration to me, and I wish I could see her more, but we don't. My 15-year-old son Ray, he spends evenings Thursday through Sunday with me, and I get to watch him play hockey on other nights. So we stay close, even though both he and his daughter, or his sister, live with their mother. My work experience, I show this because as a result of the tumor, I am no longer employed. But I have worked constantly and since 73, and my last job was from 91 to 2009 with a manufacturer. My medical history, I've had several surgeries, so I have extreme confidence in the medical world and am not afraid of going under the surgeon's knife. As you can see, I've had knees, eye, heart. I had a single bypass back in 99, and it's gone well. Had 2 brain surgeries, removed 3 tumors. I also suffer from vasovagal, and so it's just the thought of pain can make me pass out. So it doesn't make me a very good patient. And I suffer from GERD, so constantly end up choking on different spices. So in August of 2009, I was suffering headaches and these sharp needle-like pains in my right eye socket, just like, as I say, someone taking a needle to me, and I wasn't sure what was causing it, but I never thought that it would be what it turned out to be. The hearing on my right side was failing, and it just continually got worse. The initial diagnosis was when I went to the family doctor. He ordered a CAT scan. I did that, and they found an abnormality, and then we followed it up with an MRI, and they confirmed that it was a tumor. The MRI gave the dimensions of the tumor and the exact location. The fact that it went right to the surface was good. The mass was quite vascularized, which probably creates a problem that I face later. In October of 2009, still continuing here, I had throbbing headaches, and I was experiencing periods of blindness in my left eye. It would only last for about 5-10 seconds, but it was very shocking to have it happen. And to offset the pain that I was experiencing, I was taking quite a few Tylenol 4s, which were affecting my performance at work. The seizures continued to the point that I started to pass out when I was driving. And the one day driving home after playing hockey, I fainted or passed out about 3 or 4 times at stop signs. And I went right to emergency and met with a Dr. Borneo, who determined the seriousness of the situation, had me admitted to the university hospital, and notified me that I was no longer to drive, pending notification from the MTO. At the hospital, I met Dr. Bolton and his staff, and they told me what was going to happen. I was put on the emergency surgical list. So that was Monday morning that I went to the hospital, and I wasn't actually operated on until Saturday. Each day, Dr. Bolton would come and tell me, sorry, you're the healthiest patient we have in emergency. You're going to have to wait. So after about 3 days, I tell Dr. Bolton, sir, my son plays hockey on Friday night. Can I go watch his hockey game? He says, well, I was lucky. Dr. Bolton is a hockey dad, and he says to me, I'll tell you what time does your son play? I said 7:30, and he says, well, I know by about 6:15 who I'm going to do. So he says, I'll tell you in advance, and you can go as long as you come right back. So sure enough, on Friday, he calls me, and he comes down and tells me, no, I'm not going to do you tonight. You can go. So here I am with all my little stickers on my skull. I called them my Cheerio stickers. And so I put a towel over my head, and I go to the game. And my son's playing, and my brother's there with his wife. And we're at the end of the boards. My son comes down the ice, and he scores the first goal of the game. I'm so overjoyed. My brother and I have a big hug, and we both have tears in our eyes. It was just an amazing thing. So I go back to the hospital, and I share the story with Dr. Bolton. And the next day I come for surgery, and he says, you're up tonight. So he says, the ironic thing is that my son's playing hockey tonight, and I'm missing it. I said, you know, I've been here for 5 days. I don't mind waiting another day. He says, yeah, it would work for you, but I don't think I can get the rest of the OR team to go to my son's game. So we had surgery, and it went for about 2.5 hours, and I was out, and it seems to have gone well. It was a type 2 tumor, and they told me at the time that they only got 95% of it, and they explained the reasons why. And so I found out about glioblastoma, that it's never going to go away, that it will always reoccur, and I live with that. But the effects of the surgery was my symptoms had terminated. The seizures, I've not had any since, but I still take anti-seizure medication. And the throbbing headaches that I was experiencing ceased. However, I was suffering from headache pain due to the surgical procedure. And unfortunately, I have some numbness on the right side of my face due to some nerves being cut, but they even seem to be getting better. It's not as predominant as it once was. Oh yes, I guess they took out more than what they put back in because there was a depression on the right side of my head. And I was a little embarrassed about that because it seemed like that was the first thing you'd see on me when you looked at me, and I was self-conscious. We're getting to parts where I'm just going to let you read because otherwise I'll slur over the pronunciation of it and embarrass myself. I even looked up some of these words to see if I could help with the pronunciation. Some of them aren't even in the dictionary. I don't know. So I'll leave it for you to read, and it sort of tells you the microscopic description of what was done. So they determined at that time that it was GBM stage 4. Going on the internet, I find out that glioblastoma is the most invasive type of the tumor and is commonly spread to the nearby tissue. From what I understand is that the tumor will always reoccur. They can never get rid of all of it. So I've learned to accept that, and the fact that it commonly occurs between men and women ages 50 to 70 stands true with my case because I was 56 at the time, and I was a male, still am. It was in my right front temporal lobe, which impacted my short-term memory. I struggle to remember things. I do take some luminosity brain training and trying to improve my memory and my brain functions that way. I still struggle because there's been collateral damage due to the cancer, the treatments, and the ongoing problems. Prognosis. At the time, shortly after the surgery, I was told to look forward to a life expectancy of 15 months. That would take me somewhere around January of 2011. When I thought about that, all I could think, well, that takes me just, Christmas is going to be so sad. And what I was going to do to my family, which was intact at the time, was going to be just terrible and depressing. I just spiraled down, not knowing what to do. From there, I was lucky. There were some services provided by the Cancer Foundation, and I found that they helped me. And these are the people that played either a primary or secondary role in the last 4 years. I met with the neuro-oncologist, Dr. McDonald, and his staff, and then the radiation oncologist, Dr. Margaret Fisher, to discuss my treatment options. And in addition to those, these are the people that have been involved. And without them, I wouldn't be doing as well as I am today. As I put them up there, they're all important. They're in sort of chronological order, and the last name there, Jane Hauser, with the coordinator of the London Brain Tumour Support Group, has really, post-surgery, has been terrific. I I will talk about it more in further slides. Also, volunteer drivers. With the loss of my license, due to the medical reasons, I use them quite regular to get to my appointments. I mean, with the exception of my MRIs, which were at ungodly hours, they would pick me up and get me there, get me back. And I said, when I'm done this, when I beat this cancer, that's what I'm going to do. I'm going to give back. And so when I finished my last treatment back in June, I went to the Cancer Foundation and I took the course for volunteer drivers, but I was really familiar having used them. However, due to the short-term memory and my lack of focus, I did it for a couple of days and I was unable to do it. And so I had to resign. I felt bad, but I tried. I wish I could do more, and maybe there'll be a day I can do something else. Cancer at home, the impact. Again, I lost my license. My wife left me. She left me and the kids 8 months after my surgery and halfway through my prognosis. She said I had a personality change and that I was suffering from paranoia. I don't know if that's a symptom of where the tumor was located, but it had been removed. Whatever it was, it was. The kids stayed with me for a bit, but as soon as she had got a spot, then they chose to move with her. My loss of the short-term memory impacted my work, as I had said, and I'm constantly misplacing things. I've had to purchase two of almost everything that are important, and the frustration can be overwhelming to the point that it almost brings me to tears. But then I've learned to say, "Welcome to my world. This is it. You accept it, and you move on." And that's what I try to do. I mean, you can see I was in the U.S. and I lost my passport. Now, how do you do that? The most important thing when you're traveling, but I did it. And luckily the government accepted me back into our wonderful country. And but anything that's important, I lose. It doesn't matter how important it is. I still lose it. And it's very frustrating, but I'm alive, and I'm thankful for that. Initially, in public, I found myself withdrawn. I would go to hockey games instead of socializing with the other parents. I'd go off into the shadows and stand by myself. It's like, okay, well, these 15 months are coming. And, you know, I don't want people to have to make a fuss over me or have to make them hurt anymore. And I became really withdrawn to the point that it almost seemed like I was alienating myself to the other people, and they're good friends. I shouldn't have done it, and but I still, even though it's been 4 years later, I'm not as social as I want to be, but it is what it is. At work, the effects were drowsiness. I was falling asleep at my desk, and I had these throbbing headaches, as I explained, and I was unable to produce the work that they wanted. So I was displaced from two positions. I've been off work since 2009. Obviously, there's been a loss of income, my primary source of income, and my job there has been reassigned the treatment. So meeting with Dr. McDonald, my oncologist, on a monthly basis, and we monitored both my physical and treatment assessment. In 2011, the visits moved to a quarterly basis because of my progress. The MRIs were done, and everything seemed to be stable at the time. My medications were Dilantin for the anti-seizures, and I still continue to take those, as I said. And I started in November of 2009 with chemo treatments. I had the 6 weeks, 7 days of them, and temozolomide. In addition, I took radiation treatments Monday to Friday, 30 treatments of those, and then following those 6 weeks of treatment, I went on the cycles of 1 week of chemo and 3 weeks off. As you can see, I completed in 2012, which everything seemed to be stable, so I've taken off all of the chemo. In October of 2012, I had a second surgery to remove 2 more tumors. There's a third one still there, but the doctor said at the time that the risk outweighed the benefits to try and access it. I'm not having any trouble with, or having minor difficulty with my eyesight at this time, so they've left it. That's a point that, in addition to the surgical team, I met with the cancer psychologist and the cancer support worker. They're instrumental in helping me with my welfare. My health was being dealt with, but they were there to help me deal with my family issues, my depression, help me get social again, and gave me suggestions that really dealt with my welfare. My family support has been just tremendous, and I haven't had to go outside. They're there for me. My mother, my 3 brothers, my 2 sons, and my daughter have all been there. My oldest son, he took, at my surgery, he took time off, came and spent the 4 days in the hospital with me to help me during that waiting time. And he contacts me, and he constantly stays in touch with me. And I'm so proud of him for being such a caring individual, and he's doing well at work, and he keeps me in touch and up to speed with that. My brothers have been there for me. Have reached out and been there. My mother was great. I've got another brother that had me in Florida for vacation. My youngest son, as I said, stays with me. I'm just skipping through here so I don't tie you up. There's another brother out in town after my second surgery. Friends, I've got many friends from baseball that see. I've got other friends that have had cancer themselves, and they've been there to support me. The Brain Tumor Support Group have been instrumental. sorry for flying through these, but I reached the end of my time. I recently had a chance to take part in a thank you message to the Cancer Foundation of Canada. I don't have time to show it, but it was a pleasure to be able to give back in a way that's encouraging and helpful to the foundation. That's more surgery that I spoke about. I want to mention that they were kind enough that they built an insert to go on top of the portal that they put back in, and now it's not as, the depression is gone, and I feel a lot better self-consciously about going into public. Okay, that pretty well tells you everything about me. I'll just skip to I'm enjoying life. I wouldn't know that I have, people wouldn't know I have cancer because I do everything. I play ball 3 times a week. I golf twice a week. I play pool at night. I get out. I live with cancer. And I want my friends to remember me, not how I died of the cancer, but how I lived with it. And thank you for listening to my story. The one thing my doctors did for me is they got to know me, and they took care of my welfare. As I had some problems, and they helped me there. And keep doing the wonderful work you're doing. I certainly appreciate it. And I know there are others that I see in the support group appreciate it, and you're doing a great job. Thank you. Bye now.
Thank you so much, Rick. Such a great presentation, great information from all 4 of our presenters today. Just a couple things that I want to just point out that all 4 of them really refer to as our handbooks. We do have our handbooks available, the adult version and the pediatric version available, both in the hard copy and the electronic copy, as well as our non-malignant handbooks. They can be ordered, for those of you who are healthcare professionals, you can order just a couple, or you can order boxes of 15 at a time. You can send that to me directly, Janet Gloria. You'll have my contact information via email. The video that Rick Robbins referred to that he participated in, I am happy to send that out to everybody who registered today, so you can see our video. We also have our 31 Days of Stories of Courage and Hope this month, as October is Brain Tumour Awareness Month. So we really encourage you to go to our website and register for those 31 days of stories of courage and hope, and every day is a new story that is emailed to you. I'm happy to also email that link to everybody. I'm going to just check to see if there's any questions from anybody. And it doesn't look like there's any questions, so I'll give everybody a moment to type that question if you do have one. Yes, we really encourage you to go to our website to see what's happening for Awareness Month for October. We really appreciate all of the healthcare professionals out there that provide support and information and our resources to patients and families across the country. I think that everybody was able to, everybody who participated today and who gave presentations today, both Jen Hazel, Jen Brew, Karen Metcalf, or Rick Robbins, gave some really great tips and suggestions. And we just want to thank you, everybody who's online who joined us today. As I mentioned, this webinar has been recorded, so we will have it up on our website by next week for anybody who would like to go back and listen to the presentation. And it doesn't look like there's any questions, so thank you so much, and have a great day.